One of the questions I get asked is, where should I use parts therapy? Or can I use parts therapy with a client that has this problem or this issue? Should I use parts therapy with or without hypnosis? Should I use parts therapy in psychotherapy? Should I use parts therapy in coaching? Should I use parts therapy with children? Should I use parts therapy with people speaking other languages? And in short, the answer to all of these questions is yes. Okay, I've used it in all of these different instances. Parts therapy, it's such a simple concept, and it's something that we naturally use in all of our interactions in everyday life. We even talk to ourselves, and sometimes, and I'm very curious. I'm very curious. I'm going to ask you this question now. Please, if you will, respond to this question in the comments below. When you talk to yourself, do you say, I should do this, or we should do this, or both, depending on situation? Sometimes when I talk to myself, sometimes I say, well, that was not very smart, or I say, oh, that was pretty cool, or I say, I shouldn't do this, or I say, well, I think we should X, Y, Z. So I have different moments, different situations where I use I talking to myself, or I use the plural. And this is depending on the situations, but most of the time it is talking first person to myself. So the question here is, when you talk to yourself, do you use plural or singular? And if you can identify the different situation when you do that, I would be very, very curious to know. So please let us know in the comments below. I've been working with parts with a hypnotic induction and without a hypnotic induction. Like I said, most of the times you don't need to use a hypnotic induction, but sometimes it's a must. Sometimes you have to, because the client is too, so to speak, stuck in their own way of being. And by using a hypnotic induction, you actually can help them relax, and you can help them access the inner resources of their minds so that they can easier work with parts. I've been using parts therapy with children with very good results. We always like to say children have this very vivid imagination. We all do, but just children did not put a foot on it and did not kind of like suppress it. I've been working with parts with children with great results. How young, you ask? Well, if they can understand the metaphor with you are the total sum of the parts that you have inside of you, if they can understand that, then you can work with them. It's that easy. And I actually strongly recommend every coach or therapist, counselor, psychotherapist, I strongly recommend to challenge yourself to work with children, because when you do that, they will teach you how to get very complex ideas and put that into very, very simple words. And if you cannot do that, well, you need to do better. Okay? So I strongly recommend you to work with children, because they will help you so much to extract the essence out of anything you say, to say it in the simplest words. And that is a very, very good sign that you actually fully understood the information that you're trying to convey. Can you work with parts with people who don't speak your language? Of course you can. Again, I've been working with people from all over the world, and we speak in English. So let's say I work with somebody from China, or somebody from, I don't know, Spain, or whatever other languages, right, who are natives from other countries speaking other languages. As long as we can understand each other in English, which is the language I speak, then we're good to go. And even in this situation, I've had people who had very, very limited skills in English. However, as long as they understood what I'm saying, we could do the work and we got results. So it's very easy. Now, I want you to understand, working with parts is not a panacea. It's not something that you can use with everybody all the time for all the issues. Some people just don't get it. Some people their minds are not made that way. It's not because they are less. It's not because they're stupid or their brain doesn't work. No, it's just simply they're wired differently. And it will be stupid of you to push this kind of approach, push it onto them if they don't have a good reaction or good response to this. This is just a method. You have to work with a client, not with a method. I've been using parts in coaching, not necessarily for therapy, but for improving a day-to-day experience of somebody's life, but also, like I said, I've been using parts in performance. When you're working with athletes, you're working with artists, you're working with anyone who needs to perform better, maybe a leader, maybe a CEO, maybe top management, maybe cashier working in the store, and you need to have a better attitude towards the clients. I don't know, I'm just saying. So in all of these situations, you don't necessarily have something to heal. You don't necessarily have something that you need to find the part and treat the part and whatnot, but you want to be able to focus better, to learn more, to have better reactions, to have better responses, to have better attitude. And in all of instances, working with parts can help tremendously. I had a student who came to our training, and she loved it, of course. And I was teaching resource therapy, which is one of the parts therapy type of intervention. And then she realized that actually she would like to go and study at the university and get a degree, but she hated studying. So then what she did, she worked with her own parts. In her case, she was working with the resource therapy. So she worked with her own part to find the part that would love to study. And then that part would also take exams. She studied. She was, I love studying right now. And she then went on to university. She took her degree and whatnot. So you can use parts therapy for any and all types of interventions. As far as I know, there's no restriction in how far and wide you can use parts therapy. Probably the only way or the only situation where I would be a bit more cautious and where I would advise not to use parts therapy without extra support, medical support, is with people with schizophrenia or paranoia, which I'm not saying don't use it with them. I'm just saying if you ever want to work with people with schizophrenia and paranoia, then make sure that you are working closely together with a medical team who is taking care of this particular patient. I'm not saying do not use it. I'm just saying use it only together with, as part of the general medical intervention that this particular client or patient is getting. You can use parts therapy in just about any issue, for just about any subject or goal that you have, whether it's something that you want to heal or something that you want to achieve. Parts therapy is tremendously helpful for you. I love it. I use it almost all the time, almost with almost every client. I use parts therapy. And if you'd like to learn more about parts therapy, if you'd like to learn more how to apply this method with yourself, for yourself, whether to heal something from the past or to achieve something, if you like to know how to use parts therapy with your clients, then make sure to click on the link below and sign up for our Parts Therapy Masterclass International Certification Training course, where I will teach different methodologies of working with parts, and you'll basically tune in my brain, into my mind, and get all of the experience I've got over 10 years now or more of working with parts in different methodologies such as parts therapy, core transformation, resource therapy, Hegelian method, and more, all put together into one masterclass. And so you'll have more details in the video in the link below, and I'll see you in the next session.